Every year, 15 million people worldwide have stroke. In that, 5 million recover, 5 million die, and 5 million left disabled. Mostly stroke affected to elderly people. What is stroke? The brain, like all parts of the body, needs oxygen which gets from the blood. The stroke happens when blood flow to the brain is reduced or cut off. When brain cells lack with oxygen, they start to destruct or damage. As the brain controls all the body, the symptoms of stroke may be wide range. According to the area which is affected, it may be vary from drooping face, weakness in the arms or legs, difficulty speaking. Other symptomatic changes also can occur. Changes to vision, loss of balance, memory loss, and confusion. The recovery of stroke depends on early identification of its classical symptoms and its treatment. For that, the term FAST will help. FAST. F for face. Is their face drooping to one side? Can they smile? A for arms. Is there any weakness? Can they lift the both arms? S for speech. Is their speech slurred? T for time. If above mentioned any of the symptoms is occurred to the person, then that is the time to call ambulance. Stroke can be put it into two groups according to the problem in blood vessels which supply blood to brain. They can either be a blockage called ischemic stroke or bleed called hemorrhagic stroke. Ischemic stroke always occur because of the buildup of fatty material in the blood vessels. This fatty material blocks the blood supply. Bleeding stroke occurs if the blood vessels rupture, the blood lead around the brain which leads to swelling. Sometimes stroke symptoms disappear within 24 hours. This is called mini stroke or TIA. If the healthcare team suspected stroke when the person arrives the hospital, head CT scan help to identify underlying cause so that a person can be properly treated as quickly as possible. First few hours of treatment is very important. There are two treatments, it has to be started immediately. Few hours after the stroke, this treatment can't be saved the tissues. The first choice of treatment is TPA. It is a clot buster medicine. It dissolves clot and allows proper blood circulation. Second treatment is thrombectomy. It is a minimally invasive procedure for removing larger clots from brain. The effects of stroke can be disabling. This is why stroke rehabilitation is so important.
Good morning everyone. I am here to share the role and importance of rehabilitation nurse in stroke management. A rehabilitation nurse play a vital role in phase 1, phase 2 and phase 3 of stroke rehabilitation. That is acute or evaluation phase, arresting pathogenesis phase, mainly preventing further damage and in preventing the complications. A rehabilitation nurse has to work on physical, psychological and environmental aspects while rehabilitating a stroke patient. Application of Ryle's tube in stroke patients with dysphagia, that is difficulty in swallowing, helps in preventing aspiration pneumonia. So the lung and the respiratory system can be saved from further damage. Positioning strategies are adapted to prevent regurgitation, that is return of swallowed food material back to the oral cavity. By preventing this regurgitation, even choking can be prevented. Frequent change in patient's position is very much important in preventing decubitus ulcer or bed sore. By preventing this, septicemia can be prevented so that the cardiac system as well as the respiratory system indirectly gets saved. There are deconditioning which happens in the musculoskeletal system, cardiorespiratory system, excretory system, and there are other complications like orthostatic hypotension, deep vein thrombosis, urinary tract infection. All these can be prevented with appropriate nursing management. A nurse has the power of boosting patients' mental health by removing fear, anxiety, and depression. Each and every effort taken by rehabilitation nurse, especially in the acute phase, has a corresponding result in patient's functional outcome. Let's work hard in rehabilitating patients towards optimal recovery. Thank you.
Quit smoking, otherwise you may go stroking.
Have a good diabetic control. Control blood pressure.
No stroke, only exercise.
Drink more water.
Yoga is the key to reduce stress.
Eat healthy, be healthy.
Be active in daily day activities.
A stroke-free world definitely wanted.
To prevent stroke in your life, love your heart, help your brain.